My name is Rachel Winger. I'm a second-year medical student at the College of Medicine, and our speaker this morning is Dr. Kuhn. She is from the School of Public Health. We have a little introduction for her. She has a specific research interest in the interplay between animals, the environment, and infectious diseases, and in particular using novel ways to detect and describe infectious disease outbreaks. Dr. Kuhn has worked for almost 15 years at the National Danish Institute of Infectious Diseases as a senior epidemiologist. And since transitioning to the Hudson College of Public Health in 2020, Dr. Kuhn has worked with public health, city, and municipality leaders to manage COVID-19 across Oklahoma. Dr. Kuhn has served as an expert consultant on infectious diseases and climate change for the World Health Organization and the United Nations Intergovernmental Panel on Climate Change, as well as being a nominated expert in food and waterborne diseases and antimicrobial resistance for the European Center of Disease Prevention and Control. We are so excited to have you here today, and you can take it away.
Thank you, Rachel. I firstly want to thank all of you guys for inviting me here, not least because I think this is a fantastic conference and a great topic. And also, as some of you may suspect, I've spent the last 2 years of my life working on a particular disease. And this actually gave me a chance to refresh some of my old knowledge of what's going on with climate change. And I was just really excited to make these slides because it made me feel that there are other diseases and other interesting things than COVID out there. So in my talk today, I'm going to give a brief outline first of what we see changing in the world with respect to climate and the environment. Then I'm going to touch upon how these changes might affect human health with a couple of examples. And I will also give some novel insights to how we can monitor effects of these changes on some infectious diseases. And lastly, just a couple of slides on what we, working with public health, can do. What is our role in this whole setting? If you have any questions, I know there's a lot of us, but if you have any questions, I don't know if Rachel will be monitoring the chat, or also feel free to interrupt me. I had kind of planned this to be an interactive session, but that's not so easy on Zoom. So
I can monitor the chat during the talk.
Okay, thanks. So I would say, unless you've been hiding under a rock for about 10 years, it should not have escaped your attention that something is going on with the climate and the environment in the world. We see it every day in newspapers. It's sometimes highlighted in news as well, even during the COVID pandemic. Fires, heat waves, flooding. There's a lot of things going on. Since I started working with climate change, and now I'm going to reveal probably some of my age, in the late 1990s. There's been ups and downs. There's been people who support the work, the science behind climate change, and have encouraged all of our scientists to work on it. This is one of my old mentors, Dr. Tony McMichael from the London School of Hygiene and Tropical Medicine. We also had some downs in the period. A fellow Dane here, Dr. Bjørn Lomborg, who has been very vocal in saying that climate change is maybe not as strong or as severe as we think it could be. President Al Gore, I think you all know him, or sorry, not President, Al Gore, Vice President he was, has been a strong proponent, or he has been a strong advocate for research into climate change and how we can mitigate and adapt to it. And then I would say during the past, 10 years, there's been a massive increase in the number of people who have become aware. We've seen protests. Greta Thunberg, a fellow Scandinavian, has been, I would say, a role model for many young people. She's very vocal in her opinions, but maybe this is what we need. And of course, also some A-list celebrities mixing up in the whole debate here. I think you might have already guessed that this graph here with the pretty blue, red, and green colors are not just my interest in climate change, but it's actually air temperatures during the past, well, from 1860 up to 2010. And you can see quite an increasing trend. Actually, during the past 70 years or so, the rate of increase has been much higher than ever seen before. And this is what concerns us, those of us who are working with climate change. So this is not just all in our minds. There have been changes already observed. Since 1975, there has been a global increase in temperatures of about 0.5 degrees centigrade. Apologies, I only moved to the US not very long ago, so my Fahrenheit knowledge is non-existent. I just suggest you Google it if you want to. Of course, this is local, so this is global average. So we have local variations of several degrees. And as I just said before, the rate of change since 1988 is twice as high as what was observed during the century before. So it's actually the rate that we're really concerned about. It's going really fast and it's going very high. You've also probably noticed that it's getting hotter. I can't really compare because I used to live in Denmark. That was pretty cold. And now I'm in Oklahoma. That's pretty warm. But I see the headlines. I see the data. 19 of the 20 warmest years have all occurred during the past 20 years or so. And we have like 4 or 5 years during just the past decade that all broke the record. We also know that the hottest day of the year throughout the globe has increased by about 1 degree centigrade compared to 1960 to 1990. It doesn't sound like a lot, but 1 degree, it is still a lot, especially if you're susceptible to heat as a person. So it's not just the heat that's concerning us, it's also the changes in precipitation and water in general. We've seen that sea levels have increased by 17 centimeters. I would say that's about 4 inches-ish in the 20th century alone. Doesn't sound like probably a lot if you live in Oklahoma, but if you live near the coast where you experience sea level increases as a result of storms, this is quite a lot. What's really concerning is also the glaciers melting. Again, that can influence the sea levels across the world. We've seen precipitation changes in the US that actually range between a 15% decrease in some areas up to a 15% increase. So some areas have become really wet and some have become very dry. And we also know that some areas are more prone to flooding. Obviously, if it rains a lot, they will flood. Others have become very dry. And these are the areas that were already susceptible to these events. It's not just hasn't been getting worse. We are also predicting it's going to become significantly worse during the next 50 to 100 years. That's not going to affect us, but it's going to affect our children and our grandchildren. And this is also why there's such a lot of public attention on it at the minute. It's predicted that in just about 30 years, we're going to have an average global temperature increase of about 2 degrees, many more heat waves, and the extremely hot days will be getting 3 degrees centigrade hotter. Again, that's hot. That's a big increase. The same with rainfall, precipitation. We're going to have a higher risk of it already being more dry in the zones that are already dry, and also a higher risk of flooding in the areas that are already wet. So whatever you're experiencing at the minute, it's likely to become more extreme. Tornadoes are a big concern here in Oklahoma, I have seen and experienced, and those extreme events are also predicted to become worse. And as we all know that they affect certain areas, and those areas are already vulnerable with a lot of other things. So there's a whole mishmash of all different effects. I'm not going to make it sound very apocalyptic, but it is a problem, and we've started to recognize that now. So what's the bad guys behind this? I think you probably heard this in several lectures yesterday, and you might also later today. So I'm not going to go into too much detail about this, but we all know the effect of greenhouse gases. I'm not blaming everything on the cows because they're happy and pretty, but actually just taking the car to work every day, flying, those are the big drivers of the gases. Cows only represent about 9%, so they're okay. Deforestation is something that I have been concerned with in respect to my work, because I work on something called One Health that also describe a little bit later, which actually means that animals move into different areas because they don't have those environmental niches available to them anymore that they like. So they move into other areas and potentially become closer to humans. And then we have a higher risk of transmission of some infectious diseases. As with all things in life, even climate change is not fair. And we've actually seen that the countries that are shown to have the highest rates of gas emissions are also the ones that are likely to experience the less severe effects of climate change. So we have a huge, we have less emissions in Africa, for instance, where you will see a huge predicted effect of these climate changes. So when we look at human health, what are the things that concern us? Well, we have, generally speaking, we divide the effects into direct and indirect effects. The direct effect is anything that you feel when it's really hot, you sweat, and you can die from heat stroke. And anything else, it becomes flooded and you drown in the flood, things like that. The indirect effect is the stuff that I've been working on, and that relates primarily in my domain to what happens with infectious diseases. And in this case, for me, it's been mostly water and foodborne diseases, as well as some of the vector-borne diseases that I'm going to cover in the next slide. Next slide after this. We already know that some of the largest disease burdens, so some of the infectious diseases that kill the most people and also have the highest rate of morbidity, that means people living with the disease and suffering from the disease for years on end, are climate sensitive. They're very climate sensitive. Diarrhea, too many people die from diarrhea every single year. And diarrhea is something that you can prevent. If you have clean water, if the climate, if everything that happens with climate is actually taken care of in a location. And unfortunately, these 2 million people are primarily children. With respect to children, we also know that 3 million die from undernutrition every year. Again, undernutrition is driven by the access to food, which again is driven by climate. 1 million people die from malaria. Thankfully, it's been reduced over the past decade, which is probably maybe one of the best news I'm going to say in this lecture. But it's still a huge problem in the developing world. And again, these people are primarily children, and we know that malaria and the mosquitoes, because of the mosquitoes, is very climate sensitive. 70,000 people die from extreme weather. We've seen some terrible examples in the US this year and a couple of years before, with tornadoes, flooding, hurricanes. This is what happens, and it's predicted to happen even more. Overall, it's been estimated that since the 1970s, there have been around 150,000 deaths on a global scale per year due to climate change alone. So these are the indirect effects that they have on people. One of the diseases that I'm going to speak a little bit about today in relation to climate change is West Nile virus. It's a virus that's transmitted by mosquitoes, and I'm calling it the boring brown mosquito because it's kind of the one you see everywhere, and you think, okay, I'm just going to kill that thing. I do kill it. It's a name. It's called Culex mosquitoes. They are very resistant. They live everywhere. You find them all over the world. For West Nile virus, birds are the main reservoirs. So that means the virus grows and can be spread if it grows in the birds. It happens from time to time that the virus jumps over to humans because a mosquito bites a human, or also even other mammals like a horse. And this is bad for the human, but it's not bad for the other humans next to us because we are dead-end hosts. That doesn't mean we're going to die with the virus. That just means the virus doesn't replicate in us and it cannot be transmitted from us to another host. West Nile virus is kind of curious because it's in the beginning, you feel like you have the flu, or you might even not have any symptoms. So you just can feel a little bit off with a cold or a flu for a few days, and then the infection can just pass by itself. Or if you are in one of the risk groups, you can actually, unfortunately, have a very severe outcome in the shape of meningitis, and that can actually be fatal in the end. West Nile virus story is, I think it's a fantastic one, just looking at it, because we know that it started circulating in Africa. And then for some peculiar reason, the infected birds that carried West Nile virus, well, they migrate, they spread all over the world. And suddenly the virus found different habitats across the world. It was first reported in New York in 1999. And you can see now here on this little green map that it's actually present in most of the US states. And today, from time to time, there are reports of severe outbreaks in the US, even Europe and Australia. Remember, this is a virus that started in Africa, and there was no knowledge of it being present anywhere else. West Nile virus has a very strong link to climate, and I put changes in parentheses because if the climate changes, so will the virus. We know that birds are migratory. They follow the weather. So if the weather changes, the birds will go somewhere else. Mosquitoes in that place where the birds are going will bite birds, and then you can have a cycle of transmission in potentially a new location. You can also have mosquitoes that are forced, as I mentioned before, because of changes in the environment, are forced to find new places to breed. That could be, for instance, in the cities, where they can find little places of water if there isn't enough water for them in the normal nature. And then you can have transmission cycles going on in the cities. You can also have general climate changes that just create a more favorable habitat for mosquitoes. And obviously, the more mosquitoes there are, and the more infected birds there are in any location, the higher the risk of transmission to humans and the higher the risk of local outbreaks. Chikungunya is another virus. It's also a vector-borne virus, and this is kind of cool because it's transmitted by the tiger mosquito, which is a pretty little black and white thing you can see here. It's also, I wouldn't say it's a common mosquito, but here in the US it does exist. For chikungunya, it's a little bit different because humans are the main hosts and they're also reservoirs. And that means the virus replicates in humans, and I can, if I'm infected with the virus and mosquito bites me, it can transmit the virus onto the next person. Chikungunya is rarely asymptomatic, but again, in the beginning, you might feel a little bit like you have the flu or even COVID, God forbid. You can have fever, joint pain, and just feel a bit off. It's not deadly as such, but it can be very severe and disabling. And unfortunately, with this virus, you can have long-term side effects from the infection. And for newborns, the elderly, and people with comorbidities, the disease can be pretty severe. With chikungunya as well, we know that it originated somewhere else than it is present today, somewhere probably around the Indian Ocean. And then suddenly reports of outbreaks started coming from Africa, other parts of Asia and Europe, so around early 2000s. And after that, it was also reported from the Caribbean, where we know that it spread to the rest of the Americas. So that includes the United States. And the virus now exists in most parts of the US. Again, like the West Nile virus, this is very much driven by what the mosquito likes and what the mosquito does. So if the mosquito likes an area, the climate there is good for it, or it becomes even better, then it is likely to become an increasing problem. Other diseases that we know that exist and are linked to climate changes is tick-borne diseases. This is something that's also, I wouldn't say a problem, but it's definitely here in Oklahoma and in other parts of the US. And there's extremely good evidence already from Europe that this has changed because of climate. We know that the ticks that transmit the tick-borne diseases are really fussy with their habitat. So if they don't like some place, they just pack up the bags and move somewhere else. And this is it's been very evident. Some of my old colleagues in Scandinavia have shown this here in the US. You can see the ticks were here. I'm not saying this is entirely due to climate change, but I suspect it is. And then you have ticks spread all over here. Other diseases that something that's close to my heart, not because I like having diarrhea, but I think they're fun. Gastrointestinal pathogens for many years in Denmark with outbreaks, and something that occurred to us after a while was that we saw outbreaks of some of the diseases were often associated with extreme rain and flooding. And this here of this man taking a dip is actually after a severe flooding incident that happened in Copenhagen, which is the capital of Denmark. And what he's swimming around is sewage. So he's diving into poop, because when flooding happens, the sewers often overflow. And what's in the sewers? Well, we know that it's poop. And then it's really a bad idea to go swimming in this. I'm just going to say it. In case you ever feel the urge, please don't do that. After this flooding that happened in Copenhagen, we did have some pathogens and what we would define as outbreaks of others. So that for us is a very strong link to these flooding events and infection from environmental sources, because they become contaminated with feces. we know that, or we suspect, no, I'm going to say we know that infectious diseases are going to become more of a problem as the climate changes and the environment changes. But how do we go about determining whether this is really happening? So one thing that I've been working on for many years is something called One Health. When I started working on it, we didn't have a fancy brand. I called it cross collaboration, cross-disciplinary collaboration, but now it's called One Health. And the fact is really connected to what happens with the health of animals, but also what happens to the environment. So everything is all connected. You can't have healthy humans without having healthy animals and healthy environments. And this, again, reflects the fact that I've been talking a little bit about with the two mosquito-borne viruses, that if climate happens to influence our ecosystem in such a way that some places don't become more suitable for some animals, then you will have species that move. You'll have species that are lost, or some species that are thriving in certain areas. And then we know if these things happen, then something happens in the humans as well with respect to diseases. Having followed COVID probably for 2 years now, all of us know that originating animals, we suspect it's the same with the COVID virus as well. And actually more than 7% of the emerging infectious diseases that we have seen over the past few decades have all directly come from animals. Also, to put a little bit of a sample of the day, it's been estimated, and this number is just ridiculous, that around 600 to 800,000 unidentified viruses exist in the animals with zoonotic potential. That means they have the potential to be transmitted from an animal to a human. Yeah, so not so good. This One Health thing has been pretty evident in some of the large epidemics that have been observed in the world during the past 10 years. First of all, you've all heard about Ebola. Well, Ebola there was a large outbreak in 2013 to 16 in West Africa. You know, that patient, that means the first patient who was infected with Ebola in that outbreak had contact with bats. And we know also that there has been a lot of deforestation in those areas. So the bats didn't really have anywhere to live, but they don't, so they'll find somewhere else that they like. And this happened to be in close proximity to humans. And the closer the animals are to humans, the higher the chance they will transmit diseases to humans. In 2009 to 2010, we all had a great big panic about swine flu. That was also a big deal because a lot of people became infected. I suspect even actually more than the 61 million cases that were reported. We also know that this virus originated in pigs, and then it somehow mutated to human. I'm not putting the blame on this little kid here kissing a pig, but it's just to kind of illustrate how we need diseases and how they can be transmitted into the human population. So I'm mentioning here again deforestation, population displacement, population migration. If populations migrate because the climate is unsuitable where they are, as a drought, then they also bring the diseases with them that they're carrying in the local area. The origin, as you all know, is still very much speculative.
Dr. Kuhn, I think we're having some audio issues. One sec.
Okay.
Let's see. I think you were just talking about the COVID bullet point and the audio cut out a little bit.
Is it okay now?
Yes, I think so. I'm not sure if it's just the internet being funny, but
Okay.
I can hear you now.
Okay, I'm sorry. Yeah, so I just wanted to say that I'm not going to talk too much about COVID, but we suspect that it is zoonotic somewhere in an animal, and then transformed itself to be able to be transmitted in and between humans. Again, what the exact reasons are for this is something that we will learn probably in the next 5 to 10 years. When you talk about infectious diseases in relation to any change, we need to talk about surveillance also, because when we want to talk about the effects of climate changes, we need to see what's happening with the disease. With the diseases that are sensitive to climate. We know that they are often affect people who live in rural areas, people who are already vulnerable and who have not so easy access to healthcare, both in a developing world, but also in many parts of the US, for instance. Another thing we would need to do is we need to find some way of capturing changes in either the animal or the insect populations. As you've all seen during the past 2 years, is when a disease is important and we feel like it needs attention, you increase the focus on it, and that also means you increase the testing on this disease. When you increase the testing, you have what appear to be increased levels of infection. This does not necessarily mean that the disease is becoming more prevalent or that it's increasing. It just means that the attention is bigger. So you're kind of ramping up the surveillance that is already there. How would we know? If we were looking at COVID, how would we know, for instance, that the various fluctuations we've seen over the past 2 years were not driven by climate? Well, we couldn't know because we have really no comparison because the testing levels were going up and down. So we need to find a way of monitoring these diseases that accurately reflect what's going on in the population without being influenced by various testing patterns and public messaging and so on and so forth. So yeah, this is kind of what I'm summarizing this now. So we need something also that's cheap, obviously, because we're talking often about populations where they don't have access to large funds. It needs to be continuous, and it also needs to represent the population that we are interested in. And ideally, this surveillance should be able to act as a standalone or at least in addition to what's traditionally going on. During the past 10 years, kind of attempts to set up new surveillance, and I would say one of the things that I found intriguing a while back was the Google Trend. Pretty basic, actually. It's kind of a strange way of doing syndromic surveillance. Syndromic means that you're looking for symptoms in the population without having, a really accurate diagnosis. But what we find with Google Trends is they use this for influenza and some gastrointestinal diseases, is that when people start getting sick with some peculiar symptoms, first of all, before they go to their own doctor, they go to Google. And then you can actually see, if you monitor the true Google Trends, you can see increases in people saying, okay, I have increases in fever, for instance, increasing and correlating very well with influenza peaks. When it's coming, people start Googling, I have a fever and I have a headache. And then the influenza season is coming. I think this is really cool because nobody needs to be diagnosed. Nobody needs to deliver have a swab up the nose that's really uncomfortable, or deliver a fecal sample or anything uncomfortable like that. Those of you who know me also probably know that for the past 2 years since I arrived here in the US, I've been heavily involved with wastewater surveillance. And I also think this is a fantastic thing because it's completely independent of human testing. It's a little bit gross because we look at poo, but you get used to that after a while. And the good thing about it is that if you're infected with something, your organism starts excreting it almost immediately. So you don't even have to be sick with symptoms before this is excreted out in your feces or in your urine. And you can actually see that people in the community are carrying a pathogen before it even shows up in any reports from testing at all. So what's kind of the function of wastewater surveillance? Well, it's very basic. Like I said before, you're infected with something, you excrete it, and then pick up a sample from the wastewater system anywhere in the town or the municipality. We have very reliable geographical information because we know the population where it's sampling from. And as I said before, it's unbiased by individuals testing. So it doesn't really matter if there's public messaging about going out to get tested because the disease is important or not. I don't really care about that. And I would say also one of the good things is that we are unable to isolate an individual from somebody else's poop in the same neighborhood. That doesn't work like that. We're often sampling thousands of people at the same time. What we're looking for is trends at the temporal scale, also trends at the geographical scales. And these are just down here, a couple of the examples that we've been using in our COVID surveillance. We've been looking at wastewater treatment facilities in Oklahoma City. Then we have smaller sewer sheds, we call them, where we look at individual neighborhoods. Again, these are hundreds or thousands of people, so it's not individuals. And we also started out doing some work at the OU Norman dormitory to look for trends and possible outbreaks. Finally, my couple of last slides. So what is our duty and our role as public health? Why do we even bother about climate change? Well, whether we like it or not, in some way, it's going to affect the health of the people that we work with, the people around us, and it already has to some extent. We are likely to see emerging diseases in local areas. We're likely to deal with travelers that come back from other areas, bringing new diseases that maybe we never heard about, or starting a new outbreak when they come back. We're also likely to see diseases in areas where we wouldn't expect them. So that is something also to be aware of as public health experts, not to just be firmly localized in your focus on the diseases that we know are in one area. As I mentioned in one of my early slides, it's also an issue that is socially unfair. The health impacts are unfairly distributed. It affects the people who are already vulnerable and who already don't have good access to healthcare. So we also need to find a way of communicating that and focusing on that. And I would say also as the public health community, we all have the skills and we have the voice that needs to be heard to facilitate and support all the adaptation and mitigation methods that should be done with respect to climate change. Some people are saying it's too late. I don't think it's ever too late to let the voice be heard. It's never too late to do research. It's never too late to use our expertise to contribute to policy and advocacy. And it's also never too late to give advice to the public. Finally, just a fun slide to show a little bit of collaboration. Nobody works alone in this world. Infectious disease epidemiologists don't work alone. We work with many different institutes. We work with people who collect data, with people who interpret data, and we also work for and with other. And that, I think, is the end of mine. So if you have any questions, please feel free.
We have about 10 minutes for questions if anyone wants to ask. We would love if you would turn your camera on to ask your question. So go ahead. Well, I have a question if people are being shy. My question is that with the change in the distribution of infectious diseases, should we be changing our vaccine schedules or the vaccines that we give people?
Actually, I haven't yet seen any evidence that climate change are expected to affect childhood diseases. I think, if like speaking on a general level, but I think something that we should be aware of is the fact that some locations may be difficult to administer vaccines to in the developing world because of things that happen. I would say that's probably the primary. And then we would also have we would need to do a little bit more investigation on whether these diseases directly are related to things that happen in climate, whether some children are more exposed or less exposed. So we foresee a situation where we would have to change in some way the way we're delivering and recommending on vaccines.
I have a question as well. Which factors do you think are going to be most underestimated when it comes to assessing how infectious disease will be affected by climate change?
I think that's probably something that was reflected in my surveillance slides. We don't know whether the diseases are really here before they become a problem in the population. So the disease can easily be circulating for maybe a year or two, having mild symptoms. The really stupid thing about many of these vector-borne is that their initial symptom is like a flu or a cold. Nobody really goes to the doctor and gets diagnosed for a flu or a cold. I'm not talking in the COVID area here, but generally. And even if you go to the doctor now and say, oh, yeah, I think I have a cold and the flu, The doctor will take a COVID test and say, you don't have COVID, so please go home, but you might have something. And we're not going to discover those if we still have the traditional surveillance setup that it is now. So I think that is a huge problem. We really need to kind of start at the very base, because the base of all infectious diseases is really the surveillance that we need to detect them. For me, that's where I started understanding how they spread and what the implications are.
Hey, I had a quick question. I was curious of how implementable wastewater testing is in local communities. Like, what resources are needed to make it more widespread, and how specific is it? Like, if one person in a community is infected, is that tested, or do you need multiple members, even if it's not, even if they're not sick yet?
I'll start with the last part of the question. So, have really good evidence that the wastewater surveillance can detect 1 to 2 people in a community of several hundreds, 1 to 2 infected people in a community of several hundreds, and this is COVID evidence. We're still building up the knowledge from all diseases, and this is kind of going back to the first part of the question. It's very easy to implement. You need a sewage system that's sampleable, and most sewage systems are, where you can take a sample from it. With some of the rural locations where you have individual septic tanks, we do run into a little bit of a problem, because the individuals obviously need to give permission to do it. It's also identifiable at a much higher level than if you do community. And we started our surveillance with SARS-CoV-2, but we've expanded to include many of the gastrointestinal pathogens, Salmonella, Campylobacter. We do norovirus, and we do influenza as well. And then in the spring, we're going to include some of the vector-borne diseases, West Nile virus, for instance, that I talked about. So as long as you can detect the virus in a PCR sample from humans, our belief is that in a sample from the wastewater.
We have a question in the chat as well. It says, aside from COVID-19, what emerging disease most concerns you right now?
Gosh, that's a good question. I would say that, okay, this is probably, I'm colored by the fact that I worked with gastrointestinal pathogens for so many years, and I know what a huge, many of us, if we have diarrhea, we're not going to go to the doctor and take a sample. Every one person who goes to the doctor with, let's say, Campylobacter and gets a diagnosis, maybe 100 to 200 people out there also have the same infection but don't get the diagnosis. You personal, if they become more prevalent, and if they really have, we have a huge outbreak, we could be in serious problem. We could have another supply chain issue on our hands if it's really, you're still sick for 2 days and then you're fresh again. I mean, you can have diarrhea, and after that, you can also have long-term side effects in the form of arthritis, and some people even develop partial paralysis. Also, the vector-borne diseases, because I think their prevalence and incidence is highly underestimated, because we haven't done enough to proper monitor for them because of the mild symptoms that they display. So I have kind of 2 hats that I like to wear when I'm not doing COVID.
Hey, Dr. Kuhn, thank you so much for coming again. I had a quick question. Are there any resources or databases that you would recommend for us as just the public to use to just find information on emerging diseases?
And job have kind of outbreak pages. And, you know, if you want to really panic, you can read these reports every day and say, oh my gosh, what's happening? And I just had a friend text me, what's going on with that? Is that going to come to the US now? But those are really good sources. And I would say also that, if you want to focus on specific areas of the world, Africa is always an idea. Individual African health institutes are a really good source. They do some excellent surveillance in many parts of Africa. So yeah, and of course our wastewater surveillance dashboard.
Awesome.
Monitoring locations.
Okay, everyone, we have about 1 minute left in our breakout room. Thank you so much, Dr. Kuhn, for coming to give this talk. We are so appreciative. If anyone has any other questions, pop them in the chat. Otherwise, you can return to the main session and we'll have a quick break.
Thank you so much. Thank you, Rachel.
Thank you. We're so excited to have you.